I'm Dallas Ehrmantraut. I'm an assistant professor here at UJPT and been here for 3.5 years.
I'm Bremen Abuhl. I'm a Ph.D. student here at UJ, also an alumni of the DPT program, and then I'm starting to work here at the DPT program in about a month.
My draw to PT was I was an athlete in high school and I knew I wanted to do something in the medical field, so I was going back and forth between athletic training, PT, and I knew I wanted to go to the University of Jamestown to play basketball. Saw they had a pre-physical therapy track, and that's what I decided to do. After that, I observed some physical therapists to make sure it is what I wanted to do, and that's what really solidified my interest.
I think that's what happens to a lot of people is they observe and then they get excited about it. And that's kind of the same story for me too, is I was an athlete in high school, didn't really know what I wanted to do, but considered the exercise science or athletic training kind of pathway. And then once I chose PT, I started shadowing, and Dallas was actually one of them that I shadowed, and then another mentor of mine. And just seeing them just practicing in a very futuristic way really solidified PT as my career of choice.
After being a physical therapist for the last 5 years, I've really become more engaged in the field and realized what physical therapy actually is. And so it's way more expansive than I ever even imagined. And now that I'm getting into more of the research component of it, I see how much of an impact physical therapists are playing in the world of healthcare. So that's what's really exciting to me right now.
Yeah, I think for me on a patient care side of things, I've really just gotten excited about just kind of helping people realize their potential and kind of giving them space and permission to trust their body again. As far as that's kind of the patient care side of things, whereas then obviously jumping into the research side of things as well. Advocacy for our profession and growth and expansion of the profession is something that's really been exciting that wasn't even on my radar, at the beginning of school.
Bremen and I are both students within the UJ Clinical Research Ph.D. program. And early on, we had a lot of similar interests, so we had the opportunity to collaborate on some projects in that. And so recently, we had a research project that was accepted into the Physical Therapy Journal, looking at first contact physical therapists compared to usual primary care providers for musculoskeletal disorders. So we looked at a variety of outcomes.
Our research is very similar. It's kind of down the same track. Like the overarching goal is improving access to care for patients with musculoskeletal disorders. It's one of the biggest burdens on healthcare that exists. And it's kind of something that not everybody expects. Everyone knows cardiovascular disease or stroke or all those other sort of conditions. But low back pain is actually one of the most common seen conditions that is seen in primary care. So trying to improve the access and the care that those patients are given is kind of the overarching goal of mine. And that's kind of where we've collaborated is how can we bring physical therapy into that space more than it already exists, and how can we try to improve the access to care? I think that starts with definitely clinicians, but I also think it starts in the classroom too. So a lot of my research expands upon that by diving into physical therapy education and how our PT students learning about how to make good decisions for patients in this space of kind of a primary care setting, and then trying to expand upon that and compare different professions to see where physical therapy stands as an alternative to our current model that's being used in primary care here in the United States, where most patients with private insurance can go see physical therapists without any referral. So we're trying to increase the access to that to improve the access to care, to kind of that first contact pathway for physical therapy.
In regards to our specific research, the one that was just published at least, we looked at 6 different outcomes in our meta-analysis. So we compared the changes in pain ratings, change in disability, health-related quality of life, from a clinical side of things, and then we also looked at 3 societal outcomes, including cost, healthcare utilization with imaging rates, and then prescription medications. And so what we found with all of those is that PT wasn't inferior to usual primary care in any of those categories, and it actually reduced the number of imaging rates and prescription medications by a significant amount. For example, with imaging rates, it was 45% less likely for a patient to get an image if they saw a physical therapist before they saw another provider.
So we know that if physical therapists as primary care providers are causing the same decrease in pain that a standard primary care provider is, they're causing the same decrease in disability, all while utilizing less healthcare resources, ordering fewer images and fewer prescription medications. to us, it's a no-brainer that we should continue to look into this to help support our primary care teams. And I think it's important to stress that we're not trying to take away from any of the other providers, but rather we're trying to build up our primary care system to help those other providers who are seeing those more complex case scenarios to be able to manage that more effectively by reducing the overall burden like we talked about earlier.
So we're really trying to come alongside the typical providers that might be seeing patients in these settings and say, we can help and we can be effective in this setting. So it's fun to take that interprofessional approach and collaborate with the different leaders in different professions to make sure that this is providing better care for our patients and more timely care, so it's more effective overall. This research is actually quite timely in the state of North Dakota because recently Congress just passed physical therapists being able to order all images rather than just x-rays alone. So it's really exciting that our research is coming out at this time because it just applies so well based on the new legislation that has passed. And so it's exciting for the community of physical therapists because now in the state of North Dakota, we're going to be able to order MRIs, CT scans, and x-rays appropriately for patients who might need those coming August 1st. And then on top of that, further advocacy measures across the state have been happening, and it's really exciting for the field of physical therapy. Next Monday, July 14th and 15th, I'll be going down to Capitol Hill in Washington, D.C. to meet with senators and representatives, along with many other physical therapists from across the nation. It's called Capitol Hill Day, and we'll be advocating for many of the different healthcare measures that the American Physical Therapy Association supports, and specifically talking to our state's representatives to ensure that they're aware of what we're trying to promote and why it's going to be useful for their states. I've been a Jimmy from my freshman year of undergrad all the way up to DPT, and now in my second year of my Ph.D. in clinical research through the University of Jamestown, and I'm extremely grateful for everything that I've been fortunate enough to experience at the university. As far as DPT specifically, I truly enjoy getting the opportunity to show up to work every day, work with engaged students, motivated students, looking forward to learning about the field of physical therapy, and it makes it more enjoyable with the people I'm surrounded by. The other faculty that are a part of this this UJPT group is really collaborative and supportive, and it's super fun to be able to show up and engage with them every day and collaborate to improve the curriculum and improve the experience for our students. So I would say those are a few of my favorite things about UJPT and just being a Jimmy from how many years ago, 12 years ago to today.
You can continue to maintain a full-time job as you do it. For myself as a PT student, I first learned about it in my second year and I was interested in starting it. So I was actually given the opportunity to start while I was in my I had just begun my third year of the DPT program, so I was kind of doing a hybrid of both at the same time, which was really unique because it puts me at a better position to finish my PhD earlier rather than later. So I think for any student who is really interested in research, really interested in academia and teaching eventually, this would be a great opportunity to do kind of a 2-in-1 program. You can start the PhD at the beginning of your second year of the PT program. So if you want to be in leadership, if you want to be a researcher, if you want to teach, this is an absolutely great opportunity for you to get in and kind of do those. As far as DPT program, I mean, I'm a huge advocate for this program. I liked it so much I decided to come back and teach here. So I just can't recommend, like Dallas said, the professors here are just absolutely excellent, and the director of the PhD program is my advisor as well. So just had a really great experience.
Yeah, the PhD program, being online asynchronous, provides a lot of really unique opportunities for people across the globe, to be honest, if they're seeking out a PhD in clinical research. Many of our classmates aren't from this area, they're from across the globe, and we've had some students who have been really productive in the program. So it's a unique program and provides a lot of cool opportunities that you wouldn't get elsewhere.